not just anybody. Help, you know I need someone. Help.
Welcome back to this, the final segment of The Price of Business. And if you're yelling help because you need a doctor, I got a studio full of them here on today's programs with our very good friend, Dr. Geetinder Goyal. He's a regular contributor on The Price of Business. Love the work that he's doing with OurWayHealth.com, founder of that. We've got a neat project we're working on. It's kind of our own personal crusade to better healthcare here in the Houston area, and I'm loving working with him. And we've got a great guest who I think has a very similar objective to what Dr. Goyal and I have, and that's Dr. Chris Skisak. He's a PhD, and he's a director of the Houston Business Coalition on Health. Welcome to both of you, gentlemen.
Thank you.
Glad to be here.
And Geetinder, why don't we start with you? Kind of tell us your elevator speech, if you will.
Yes, thank you. I'm founder of Our Way Health. It's a direct primary care clinic, and it is based on the premise that 80% of your healthcare needs in a lifetime can be taken care of by your primary care doctor's office. It's not possible nowadays because primary care doctors hardly are able to spend time with their patients. So what our model is based on, our clinic is based on, is put the time back into a doctor-patient relationship. Take the fee-for-service system out of it and provide good quality primary care. So that leads to better health, cost savings eventually.
Yeah, very good. Why don't you tell us about our guest today?
So we have the pleasure of having Dr. Skisak here. He is the executive director of Houston Business Coalition of Health, and I'll let him explain more. But Houston Business Coalition of Health exists mostly to represent the employers in the city of Houston, as well as other stakeholders in the healthcare space. So that includes our health systems, our insurance plans, as well as physicians. And the idea is to bring all the stakeholders together to constantly work on how we can provide more value while lowering the costs.
Very good. Sounds like great objectives. By the way, I noticed here, Chris, that you guys were part of the Houston Wellness Association, or actually there was a merger between you two back in 2015.
Yes.
I had the folks from Houston Wellness on many times over the years, and so it's a great organization. And it sounds like what you're doing is extremely needed today.
It is. Thank you for having me. We are a merger of the old Houston Wellness Association and the former Houston Business Group on Health. Our mission as HBCH is to be the leading resource for employers who want to continue to provide health benefits at a sustainable cost while improving the quality of care and also the patient experience. We have 61 members right now, representing 250,000 lives in the city of Houston and more than 1 million nationally. We do this, we have a program on Thursday on the future on employer-sponsored health care, the future of employer-sponsored health care. We're excited. We have well over 100 representatives. HBCH is a multi-stakeholder organization, meaning we have all participants in healthcare delivery and benefits design, healthcare systems, physicians, employers, hospital systems, but we look at it from the focal lens of the employer. So we're excited about where we're at right now.
And you have 60 members local, and that's 60,
These are all
60
local
institutions.
Yes.
Yeah, and I'm assuming, based on the total membership, that they're rather large businesses. They're mid-market or enterprise level.
Our smallest member is about 200 right now.
Yeah.
Our largest is 80,000.
Yeah.
So we have the mix and the range, which is needed. We want to give a voice to all. We're employer-centric, but we want to give a voice to all to figure out how we can improve cost, quality, and experience.
Geetinder.
Chris, I was going through your website, and you have written a very nice piece about explaining the philosophy behind HBCH. And one thing that caught my eye was this term value gap. And if you could just share with us briefly and for our listeners, what does value gap mean in healthcare?
Well, let me give you some information here. If you look at the healthcare costs in this country over the last 15 years, the price of healthcare has risen by 200%. If you compare that to the rate of inflation or the rate of employee wage increases, there's about a 4 or 5-fold gap there. Mm-hmm. On the other side of the coin, if you look at the care, the outcomes we're getting from that increase in expenditure, I think most would say we're not getting that value. Mm-hmm. So the idea is, how do we best get value? Value is defined by cost divided by benefits. So if you're going to improve the value, you either have to decrease the cost or increase the benefits. And so we look to do this through a variety of ways, working with healthcare systems, working with employers. There's a lot of moving parts here, and everyone plays a role, including the patient. There has to be some measure of the individual taking ownership of their health in this dynamic working.
And arguably, especially the patient. I think it's because the lack of the patient's part involved in this is why you have that 4 to 5 times gap, is because it's funny money. It's funny relationships involved. There's a disconnect between what the consumer is paying and what's going on with the various providers. And that funny thing is what's got to be addressed. And that comes from consumer ownership, consumer driven. It's an expression used in the insurance industry. Your thoughts?
One of the things that a lot of employers are doing now is with the advent of high deductible health plans, consumer driven health plans, you're kind of throwing the consumer out there. Well, you can't do that without providing them tools and resources to become better consumers. So a lot of employers are going towards various models of transparency, tools that can be used, various incentives to get employees engaged in their health. So that has to be an ongoing process and will be a huge factor in the coming decade.
Yeah, very good. Geetinder?
You talk about employee engagement and, how to get them more involved in the process. And I feel like having a primary care physician that is really involved in that process is a key to patient engagement. It's hard to expect patients to be engaged when your primary care physician is spending 5 minutes with the patient and the patient ends up spending 2 hours in the waiting room. So I feel like we have to start by changing the primary care culture in this country. And that's what our organization is about. So help me in understanding how our organization can work more closely with HBCH in getting the word out there.
Well, we're going to help you. We preach the need for primary care physicians to work with their patients. We're going to promote the preventative aspect of healthcare.
Yeah.
As I mentioned to you earlier in our discussion, chronic conditions are so important. Getting the early detection, the better treatment, and the proper treatment for chronic conditions. That is the huge cost burden for this country in terms of healthcare. Mm-hmm. That is first and foremost a responsibility of a good partnership between the primary care physician and the patient. So we will be speaking on your behalf.
Got to wrap it up with that. I'm sorry, we're going to run out of time. But do want to mention, again, really grateful for Geetinder Goyal for bringing us part of today's show, and Paul Carroll over there at Efficient Wealth Management, and also our good friend, Taxman Bob Lozer. Really quick, one last question. You guys have monthly meetings, like this meeting that you have coming up. Is that monthly that you do that?
We have monthly meetings this year. It'll be a little bit different next year. But yes, our next program will be on value-based insurance design, November 4th. So we welcome our members and our guests to come. You can go to www.houstonbch.org for more information.
ourwayhealth.com. That's how you reach Geetinder, and also you can learn more about the work that Chris is doing by checking out HoustonBCH.org. Thanks, gentlemen.
Thank you.
Kevin.
All right, when we come back tomorrow, we're going to have much more for you. Do want to remind you the show continues 24/7 at priceofbusiness.com. While there, like it on Facebook, follow on Twitter. Have a great day. Spend it right here on this station.